Behavioral health is a challenge everywhere, but there are special challenges when it comes to behavioral health in long-term care. Today's guest has helped crack the code. Hi, everyone. I'm David Williams, president of strategy consulting firm Health Business Group and host of the Health Biz Podcast, a weekly show where I interview top healthcare leaders about their lives and careers. My guest today is Rocco Coniglio, serial business builder in healthcare, currently at Red Rock Capital and Advisory. If you like this show, which I'm sure you will, please subscribe and leave a review. Rocco, welcome to the Health Biz Podcast.
Thank you, David. Thanks for having me.
We're going to talk about what you're up to now, but I want to roll back the clock and learn a little bit about your background. What was your childhood like, and any childhood influences that have stuck with you throughout your career?
I think I had a fairly normal childhood. Grew up in Pittsburgh, Pennsylvania. I was born and raised there. Huge Steelers fan, huge Penguins fan, and only child. And had a pretty close family, half Greek, half Italian. So a pretty, I would say a pretty volatile mix there. So a lot of passion in those ethnicities. But, I grew up playing a lot of sports. Football was a big one for me. I did a little bit of track and field, did a little bit of wrestling. Ended up going to school at the University of Mount Union in Ohio. Played college football there. Had a great run while I was there. We were in the Division III level, but played 5 seasons, won 4 national championships.
That's pretty
during
awesome.
that course of time.
Did you know about that school ahead of time? How'd you learn about it in the first place?
I did, yeah. I mean, I knew that they had a good football program. I knew that I wasn't a Division I prospect, and so I wanted to go somewhere that I'd have an opportunity to play, but also be on a team that was going to win, because losing is miserable.
Yeah.
And that was advice from my high school coach. And so I went on a visit. It wasn't too far away from Pittsburgh,
Right.
but it was far enough away. And it was a great decision. I still have tons of relationships with guys there that I played with. And, the program really, I got there at the perfect time, because the program at that time, I think they had won championships in 93 and 95 and 96. And then when I got there, we went on a run and won in 97, 98, lost in 99, and then won again in 2000 and 2001. And Larry Karras was the head coach there, and just an amazing coaching staff, led by him. And he's now in the College Football Hall of Fame. And just have a lot of appreciation and respect for what I learned there, being a part of the program, but also just a ton of stuff that you can take away from those coaches that apply in real life. So I'm really thankful that I was a part of that team, and got to get exposure to the coaching staff there, because they were an excellent group.
What was your position?
I played middle linebacker.
Nice.
Yeah.
Very good. So then it sounds like you did some early career stuff. I saw a lot of healthcare, well-known names, McKesson, Cambridge Heart. How'd you get into that space? Was it based on, I think you're studying human physiology, business in school?
I was. Yeah. And I was more on the science side in my undergrad. Had a minor in business, and then moved back to Pittsburgh after I was done at Mount Union, and went to Robert Morris University. So went right into grad school, got my MBA, and then shortly thereafter got the job with McKesson, moved back to Northeast Ohio, spent 20 years in Northeast Ohio. And my career started with McKesson for a couple of years, was selling in the med surg business. Cambridge Heart was a short stint there for about a year with an electrophysiology play, and spent 4 years at Gambro, was nephrology critical care, kind of selling into that space, and covered Cleveland and Pittsburgh, so like mostly Western PA and Northeast Ohio, and then moved on to Medtronic for 3 years, was selling into the OR, so surgical sales with Medtronic, and that was a great company to work for. And then my last real employment was with Spectranetics. Was there for 4 years. Was pretty specialized. That was probably my favorite job.
Yeah.
It was electrophysiology, cardiac surgery, interventional cardiology, and peripheral vascular surgery. And had a lot of fun doing that. Great culture, wonderful leadership team there. Scott Drake was the CEO there, and really created a really unique culture that probably didn't see much of in some of the other companies that I was in. But I really appreciated the experience that I got there.
No, that's good. So you said that was sort of your last paid employment, and then take it you founded the next company, Psych 360?
Yeah, so I actually co-founded that company with my wife, Nicole, and she's an acute care NP and a psych NP. And we co-founded that company in 2015 while I was at Spectranetics.
Got it.
So the idea when you're founding a company, there's no money coming in the door.
Yeah.
And it's much easier to take that risk when you're younger in your career, and we weren't at that stage, so it was probably not a great time to start a business. Mm-hmm. But if you're going to start one when you're mid-career, you have a family and everything, if you can do it while you're while you've got some other income source, like that's a huge benefit. So I did that. I was really doing very well at Spectranetics. So from the standpoint of doing two things at once, I don't think anyone really cared what I was doing because I was performing well. And so I was able to hold that job down for 2.5 years before I had to really make a decision to move on. And unfortunately, in 2017, Spectranetics got bought out by Philips Healthcare. And so I knew at that point, that was announced, I believe, in June of 2017.
Yeah.
I knew at that point that like a lot of changes were coming.
Right.
And it was getting really unsustainable. I mean, had 3 little girls. My dad had dementia. We were primary caregiver for him.
Yeah.
Running our own business and keeping a W-2 job. It was like, not going to continue long term.
Tougher than being a linebacker.
Yeah. Agreed.
More to keep your eye on. I don't know if there's more or less tackling though.
That's a really good question. I'd have to think about that.
Yeah. It's a close one. Probably depends on the game. Okay, so it seems like the concept was about mental health care in long-term care. Is that right? It sounds like an interesting niche. How'd that come about?
Well, it was really Nicole. I mean, she was working in the long-term care setting in 2012, and she came home one day, and I was at Medtronic at the time, and she said, "Look, I'm getting all these patients. I think there's a business opportunity here. I'd love to specialize in this area. I need to go back to school for another 2 years to get board certified in psych mental health.
Yeah.
In order to really see this through and be able to run a business like this." And I said, "All right, let's do it." So she went back to school when she graduated in spring, I'd say May of 2015, and she had her license in July. We started the business in July, got our first couple of contracts in August, and it was off to the races from that point forward.
And what's different about mental health care in long-term care compared to some other setting?
Yeah. Well, I think what really struck Nicole when she identified that niche was that she was in primary care, and she was having to deal with a lot of the specialty of psychiatry and mental health as a primary care provider. And a lot of primary care physicians and advanced practice nurses are not comfortable with those types of medications, and they just don't have a lot of training and experience in that area. So from that standpoint, what happens is in the long-term care setting is that there's not a ton of specialists that practice in psychiatry in that particular area. And in 2015, it was much worse than it is today. And the other component to long-term care is that if you're a psychiatrist or a psych NP and you're practicing an outpatient or you're practicing in an inpatient setting, you have much more flexibility in your prescriptive process. And in long-term care, those medications are very highly regulated. So psychotropic medications are highly regulated. Now, they became more regulated as time went on from 2015 go forward, and that had to do with the mega rule with CMS. There were 3 phases to that mega rule, and long-term care was a component to that, and psychotropic medication was a component of the long-term care regulation of the CMS mega rule that rolled out in 3 phases over the course of about 4 or 5 years.
That rule, Rocco, was in order to prevent, say, nursing homes from taking care of their patients in a way by putting on medications that might not be appropriate for them, that might make it easier for them to care for them, but wasn't right. Was that some of the impetus for it?
Spot on. So if you look at the history of the nursing home industry, really, you could take it all the way back to like the 1970s. So like in the 1970s, deinstitutionalization occurred throughout the United States, which really meant that the government was no longer going to fund mental health hospitals, where you would have more severe mental illness, and that's where they could provide care. So when those patients were no longer cared for in that particular setting, they basically went to three places. One was homeless, another one was being incarcerated, and another one was nursing homes. And nursing homes were not equipped and not designed to take psych patients. So as those patients with mental illness became more prevalent in the nursing home setting, they physically restrained them, and then that got regulated. And then they went and began to chemically restrain patients. And you chemically restrain patients mostly with antipsychotics. Antipsychotics in a geriatric population have a black box warning. So, it's a really severe medication to prescribe as a first-line medication in that particular patient population. But it's common practice in like the hospital setting to, prescribe things like Seroquel and Haldol and do it off label, or without, the appropriate diagnosis. And so, as time went on, in the early 2000s, they instituted gradual dose reductions on antipsychotic medications in long-term care. And then those gradual dose reductions, those GDR regulations in the long-term care setting expanded with the CMS mega rule to all categories of psychotropic medications. So, and then the diagnosis for those medications became more narrow as well, specifically on psychotropic or specifically on antipsychotic medications. So if you're not complying with that in the long-term care setting, then you're setting yourself up for risk associated with your state and federal surveys.
Yeah.
And that all is a component of your 5-star rating, and your 5-star rating is going to deliver, is going to allow you to get referrals from hospitals. So if you're 3 stars and above, you're able to get your short-term skilled patients in the building, and those are really those are more lucrative for the nursing homes because they are able to bill Medicare, whereas typically the long-term patients are Medicaid patients, and that's a little bit more challenging to make it financially productive.
Now, you talked about psychiatrists in long-term care. The truth is there's a shortage of psychiatrists, and you don't actually see that many physicians typically in a long-term care facility of any specialty. And so I believe that you've done some work to leverage, other clinicians, including advanced practice nurses, if I've understood that right. How do you think about the labor model for what you do?
Yeah, we were really worried about that bottleneck when we first started the business because there weren't that many universities with psych NP programs in 2015. Yeah. And, frankly, psychiatrists kind of have their pick of what they want to do. And long-term care in nursing homes is not like the first thing that they're going to jump at. They tend to gravitate more towards inpatient work, outpatient work, and nursing homes tend to be kind of like a side gig for a little bit extra money here and there. And so there wasn't a whole lot of focus. There was one particular company that had scaled a model called Med Options out of Connecticut. They're no longer in existence, but there was a scaled successful model at that time. So that gave us some confidence that there was an opportunity to perfect that model. When you look at it from a labor market standpoint, what we did was we started really early in 2016. We started to approach any university that had a psych NP program, offered clinical rotations for their students, and that was probably one of the smartest things we did because as more universities saw the need and began to develop those psych NP programs, we ended up having over 20 contracts with the universities across the country to be able to do clinical rotations. And then when they graduated from those programs, we had kind of the pick of the litter when they came out of those programs. And what was attractive to them, we made nursing home, work a little bit more attractive than it otherwise would be because, it was a company that was an NP-driven, NP-run company. It wasn't necessarily, anything where you had, it was like a physician-driven company, and not that there's anything wrong with that. It's just that I think that the nurse practitioner group took a pride in being able to deliver high-quality care as APRNs and not having to necessarily rely on, physicians to be able to deliver that care. And I'll say, I think there's a lot of politics between, APRNs and what they can do and what the scope is versus what physicians can do. And, I think that there's a ton of great physicians out there. There's a ton of great NPs out there. And on the flip side, I've seen bad doctors and I've seen bad nurse practitioners. Yeah. You just have to make really good hiring decisions and make sure that, the culture is right. And I think we had a really high quality product and it was well recognized within the long-term care setting.
Now, what about telehealth? Telehealth is something that was leveraged maybe after you got the company going, especially during the pandemic. Was telehealth an important part of the delivery model?
So that's a great question. Telehealth, when we started, we did not use telehealth at all.
Yeah.
There was a company out there called Forefront Telecare that was primarily doing telepsychiatry in the nursing home setting. Mm-hmm. And they were focused on rural markets because you had to be. Yeah. At that time, prior to the pandemic, you were very restricted in where you could deliver telehealth. When the pandemic hit, that threw a lot of us that were coming in person for a loop. I mean, it was like in March of 2020, it was very uncertain. It was wild. But we quickly figured out, like, if we're going to sustain this business and survive this, we had to use telehealth. So within a couple of months, we were probably doing north of 70% of our visits via telehealth. And that was a testament to the team that we had at that time. They really, everybody kind of pulled together and we changed a lot of operational things quickly in order to continue to deliver care in that market, but still navigate the infection control processes that were being put in place to navigate COVID.
And now, did you merge this company with another company? Or sort of looking at the at the path, it looked like there's a combination that occurred at some point down the road.
Yeah, so what we did was in August of 2022, there was a relationship that had developed from late 2021 with the CEO of MindCare, and they put an LOI together in May of 22, and we ended up closing a deal in August of 22. They didn't have a long-term care vertical. They operate in the acute care space, delivering psychiatric med management care to the emergency room setting, and had one of the largest footprints in the acute care setting. And we felt like, from a philosophical standpoint, they understood mental health, but they didn't really know the long-term care market. And it was kind of a nice match because we felt like we could bring a lot of value from the long-term care side and a couple other things that I think we did really well. And so, we made the decision in August of 22 to finalize that deal, and then they brought Nicole and I on and relocated us to Nashville.
Got it. All right.
Yeah.
So that sounds like a good process. I know you're involved in putting everything together, which is always a fair amount of effort. What are you focusing your time on these days?
Well, we did about 18 months post-acquisition and transitioned Psych 360 into MindCare. At that time, we decided to really focus our efforts on looking at healthcare acquisitions, and so that's where we we started Red Rock Capital and Advisory, and most of my days now are spent evaluating different types of deals that are out in the marketplace. Some of those are deals that Nicole and I could potentially be operators in, and some of those deals are more for passive investment or potentially board or strategic advisor roles in a more of an independent sponsor type of a role. So we've really have done a lot of work over the last few months to get that business going, and create a lot of healthcare deal flow over the course of that time, build the investor network, and so we're enjoying that part of the process now. It's something that is fairly new to us, but we feel like given our operational experience in this particular market, there's a lot of value we can add.
So my final question is one that I ask all the guests, and it has to do with any book recommendations. I wonder if you've had a chance to read anything good lately, anything that you might recommend to the audience.
The only thing I've been reading lately is Offering Memorandums.
Yeah.
And
some people call those a book,
Well, they can be. Yeah, they definitely can be a book. I would say Harvard Business Review put out a book on entrepreneurship through acquisition,
mm-hmm.
and I think that is it's good because it's educational around entrepreneurship. I think there's a lot of different ways you go about it. I'm passionate about that in particular, and I just mentioned that because you don't always have to found a company. You don't have to take it from zero to PE exit. You can. There's a there's a trend right now with a lot of baby boomers that have been entrepreneurs and business owners in the small business area for decades, and they're looking to retire, and they've built good businesses, good solid businesses that can be acquired by a lot of people that even don't potentially have a lot of access to capital, and there's a lot of unique and creative ways to do that, and I think in many respects it could be it could be more beneficial and easier than starting something from scratch, because if you buy a profitable business, you don't have to really do what I did, which was keep your W-2 and balance that whole thing, especially if you're at a different stage in your life where you can't take that risk. So So that's one book that I would say is a worthwhile read.
That sounds like a good choice, and I haven't actually heard that one recommended before, but it sounds good and more interesting in some ways than some of those offering memorandums that you are looking at, or I guess memoranda. Well, Rocco Coniglio, serial business builder in healthcare, currently at Red Rock Capital and Advisory. Thank you for joining me today on the Health Biz Podcast.
Thanks for having me, David. Appreciate it.
You've been listening to the Health Biz Podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.